Okay, so let's go. So this is a 7-year-old African American child who has a history
How
of
many?
7-year-old
Mm-hmm.
who has a history of sickle cell anemia presented with chest pain.
Mm.
Temperature is 102, heart rate 96, respiratory rate is 21, BP
Mm.
is 118/65. Okay,
Mm.
so this
Mm. Shit. Shit.
okay.
Hold on. Hold on. Hold on. Hold on. Hold on.
Okay, yeah, so the full history is that he's having sickle cell. He has a 1-day
Mm-hmm.
history of right arm pain, chest pain, fever, non-productive cough, mild shortness of breath. He described left-sided chest pain, 9 out of 10, aggravated
Mm-hmm.
by deep breath, not relieved by anything. He denied any kind of injury. He's on a prophylactic penicillin
Mm-hmm.
and received pneumococcal vaccine.
Mm-hmm.
Okay, the development is fine. And the social history, he lived with mom, dad, and older maternal cousin.
Mm-hmm.
And that's about it. There's nothing else. Like, that's the main thing, is that he's having right arm pain, chest pain, fever. So what do you
Mm-hmm.
do now? He's at the office.
Okay, so he's in the office, right?
Mm.
Um. First of all, I think he should be in the ED if anything, because I think he's having crisis.
Yeah, let's do a podcast physical really quick. Yeah.
So if you want to do like a quick physical, just
Mm.
and then what do you think? Do you
Yeah,
think
yeah,
I should?
yeah, yeah, you're right. Let's just do a quick physical, 6 minutes.
Yeah.
So he's in respiratory distress.
Mm.
He has a pallor,
Mhm.
tenderness over the right arm, ribs, and sternum.
Mhm.
Heart sound is normal, no murmur or gallop.
Mhm.
And there is increased tactile phragmitis over the right middle lobe. Okay, now, so we should just send him to the inpatient, right?
Mhm.
He's in,
Yeah, I'm gonna send him inpatient because we need to take care of him like
yeah.
acutely. We don't have that kind of
Yeah, you're right. Okay,
like.
so what do you want to do right now?
I want to start him IV access. Give him IV fluids.
Let's do a
Give
pulse,
him pain medication. If you want
oxygen,
to give him
IV fluid,
morphine,
some
oxygen. Yeah.
motion,
Check his vitals periodically.
input,
And how old is he? You said 7.
yeah,
Um,
just pneumatic
give him folic acid.
PT,
All of that stuff. PT, PTTA.
INR, CBC, CMP, type, analysis, this is sputum, EKG, what else? It's the chest X-ray, that's number one. CBC, LFT,
Just like
lipid panel,
beautiful
and
CBC.
TSH.
Mm-hmm.
There's the vitals, cardiac monitor,
He did ESR and all that.
BP monitor, yeah, ESR.
Mm,
Let's give him regular diet. Anything else?
you gave him folic acid?
Folic acid, yeah, that's good. Huh?
Or we can give that later too. I mean, it's up to you.
So, and then what else? What is missing? The most important thing for
Penicillin?
ceftriaxone, yeah.
Or ceftriaxone, okay. Oh, I told you I don't like antibiotics.
Yeah,
I always miss them. Okay,
yeah.
ceftriaxone.
And azithromycin.
Oh, okay.
Okay. Let's give him albuterol. Okay. That's it.
Why are you giving albuterol for? He has
He's having, yeah, just to dilate his bronchus, he's having wheezing on the lung
Mhm.
exam. Let's do it every 24 hours.
So maybe I'm confused, but when do you give penicillin for sickle cell? Oh, when they're before 5, right?
Yeah, this one is like, yeah, you give them like prophylaxis.
Hmm?
You give them prophylaxis before 5. Yeah, you're right.
You're gonna do his sputum for Legionella and everything?
No, it's not important. Just the ground stain. That's the most important one. Yeah.
Mm.
I'll just do it now. Just mix it there.
Mm-hmm.
So let's do protocol. Lipid profile. Serum. Water. Okay. How do you monitor? People. So, just give a normal diet. Focus therapy. Now what do you want to do? Let's just advance it for an hour.
Let's check on him.
Yeah. After an hour we check.
Mm.
That's fine. Let's just check on him. Okay, he's hoping the medication will help. He's feeling a bit better. Now, what do you do now? Let's do hemoglobin.
Mm-hmm.
Good.
Yeah, in case if he needs transfusion, right?
Yeah.
What were the results? Did you get any results? I didn't hear you say anything.
Yeah, the results were fine. Like, it's just nothing that's abnormal. Only the chest X-ray was
Mm-hmm.
indicating acute chest syndrome.
Mm-hmm.
And then this one, let me see. I don't know why. So hemoglobin and hematocrit. We got a hemoglobin, hematocrit. Got it every 4 hours.
Mm-hmm.
Okay. And now I'll just advance to the next day. And I think this much case will end.
Hmm?
Like now the case will end. Like that's it because you've
We
done,
did everything
yeah,
pretty much,
just
yeah.
did it. There's nothing left to be done. Check on him. Yeah, he's feeling better.
Mm-hmm.
The patient. So just keep him for 2 days in the
Mm-hmm.
thing, and then you just discharge
So
him.
he
So I'll
so
discharge
he
him
did
on Thursday. Huh?
so he did have sickle cell crisis, right?
Acute chest syndrome.
Acute chest syndrome, sorry.
Yeah.
So basically ceftriaxone and amoxicillin, right? That's what you give him?
Yeah. Yeah, you did. No, so he's feeling better. So just discharge him home.
Okay, let's discharge him.
Schedule.
Did we need to counsel him and his parents.
Yeah.
Not him, but his parents, I think.
Yeah. Just. Oh, I forgot the right counseling. Okay. Yeah, I should have brought counseling before discharging him. let's see if I can order counseling. It's counseling the parent and reassurance education. And then we gotta stop the IV antibiotics also before. And just see him next day in the office. Next week. Yeah, so that's about it. The case will end at this rate. So now, this patient is having. So what is the most common cause of death in children with sickle cell?
That's a good question. It's not coming to me. What is it?
Acute chronic pulmonary complication, chronic or acute pulmonary complication, chest syndrome.
Acute pulmonary complication?
The acute chest syndrome, that's most common.
Acute chest syndrome. Oh, that is the number one cause of death?
So this we have a challenge to differentiate acute chest syndrome from pneumonia. What is the difference?
That's true.
As the blood culture and sputum non-diagnostic.
Well, of course, acute chest syndrome will. Is it the lungs? You won't see any infiltration or.
Yeah, on chest
And
X-ray. Yes.
consolidation, maybe?
Yeah.
What did you say the X-ray showed?
Yeah, it shows infiltrate and diffuse infiltrate. That's a big differentiating factor.
I think so, because if it was a pneumonia, it would be lobar or it would be consolidation into one confined lobe.
Yeah. How about acute coronary syndrome? How do you diagnose that in sickle cell?
Acute coronary syndrome in a 7-year-old with sickle cell?
No, it's not like they can have stroke more likely.
Yeah.
Not acute coronary syndrome. This is most common cause of stroke in sickle cell. So the differentiating feature between pneumonia and acute chest syndrome is that fever more than 38, tachypnea, wheezing, or cough, chest pain. That's how they present. And on the examination, you have local tenderness over the ribs or sternum. Okay, so that's a big differentiation. Another thing, you will have leukocytosis, thrombocytopenia, thrombocytosis, and falling hemoglobin concentration, increased lactate dehydrogenase, increased bilirubin. So this happened in acute chest syndrome, but not in pneumonia. Okay. So what is the acute management for acute chest syndrome?
You have to give them fluids, pain management, stabilize them, and give them antibiotics such as ceftriaxone and amoxicillin. Amoxicillin, right?
Yeah, so this you give oxygen, number
Yes.
one. Second thing, narcotics. Third thing, volume resuscitation. And the fourth thing, incentive spirometry to prevent atelectasis. We didn't do it here, we should have done it. But,
Oh yeah, we should have done spirometry, right?
yeah. And antibiotic covers strep pneumo, Haemophilus influenzae, and mycoplasma, and chlamydia. And then, but what if the patient have hypoxia with a new infiltrate? How do you treat that? You do exchange transfusion.
Okay.
So this is the acute therapy. How about the chronic therapy? What is the chronic therapy?
You give them what do you call it? The hemoglobin F hydroxyurea.
Yeah, you give them hydroxyurea for vaso-occlusive, and you give them penicillin prophylaxis with penicillin V.
V.
Yeah, children age 4 months to 3 years.
Yeah.
And you give them pneumococcal vaccine, both adults and children. Yep. So that's a summary for this case. So this is basically it. Like you gotta examine him, send him to the inpatient, do the VPanic, police PS, and then you do CBC, LFT, ICU, the packs, and then you do the hemoglobin, hematocrit, ceftriaxone, oxygen,
Yeah.
azithromycin, and then give him IV fluids instead of spirometry, and chronically you give him pneumococcal vaccine and hydroxyurea and penicillin V. And that's about it for this
So we should
picture.
discharge him on hydroxyurea.
Yeah, you can do that. Yeah, that wouldn't hurt. Yeah, you can do that. Yeah, so that's about it. Like here, they did not discharge him, but you can do that. Like if it's.
So when you asked me a question about hypoxia with new infiltration,
Yeah.
you said, how will you know it's a new infiltration?
Like after you repeat the chest X-ray next day.
Oh, I got you.
Okay. Okay, so that's it. Let's just take a break. Okay, and I'll call you in an hour or so. Okay.
What happened?
I'll call you in 10, like at 10.
Oh,
Okay.
okay.
Okay. Now I have to go.
Okay.
Okay. So I'll see you. It was
All
nice.
right.